Do you ever do this? I look at a magazine or a newspaper and I go, oh, you know, I'd love to look like that. You know, I wonder if they can make you look that way. Well, apparently it's not just, you know, the regular folks like us who do that, but celebrities, because they're going under the knife all the time. And sometimes it works, sometimes it doesn't. Actress Tara Reid, one of the ones that came out and she said, boy, my cosmetic surgery was botched. Michael Jackson admitted having surgery for a skin affliction. So are they beauty junkies? Joining me is Dr. Jennifer Walden. She is a plastic surgeon who practices here in New York City. It's good to have you with us. Let's take a look at some of the before and afters. We've got Tara Reid, and she clearly said that she wasn't very happy about what had happened afterwards. She said, in fact, that her breast augmentation didn't look so hot.
Sure. Tara actually came out and explained what happened quite well. She said she went to a plastic surgeon. She went to the first person that she consulted with and probably ended up getting big implants for her body frame and overzealous liposuction. She subsequently had to get reconstructive surgery. One of the points to learn about this is don't go to the first plastic surgeon that you meet. Go to several different people. End up going to one that you click with or are comfortable with, and it's also board certified by the American Board of Plastic Surgery.
And then Michael Jackson, I mean, we all know the before and afters of Michael Jackson. Such a cute kid and rather a little frightening. I mean, when you look at this, what can explain it?
I mean,
with all due obsessed. I mean, do people become obsessed beauty junkies?
Right. With all due respect to Michael Jackson, he probably has what is called body dysmorphic disorder, where he is seeing things that are way out of proportion to what is actually there, and he underwent a major change in his face and body. Obviously, he told people he had vitiligo, but got all of his skin on his face over bleached. He got multiple different nasal procedures, which ended up with a skeletonized nose, no cartilaginous support. Very, very deformed lips, and I think that this is just a major example.
Hey, you know another one that was kind of scary. We saw it a lot here in New York City. Jocelyn Wildenstein. And probably if you don't live in New York City, you don't know who she is. But take a look at this picture. She's now called. I think most people refer to her as the Cat Lady.
Right.
I mean, when someone does so much plastic surgery, don't doctors have an obligation to say, no, I won't do it?
They absolutely do. Jocelyn Wildenstein, as we know in Manhattan, wanted to look like a cat and has undergone so many operations. Her face is very scarred.
I mean, you've got to be a little nutty to want to look like a cat to start with.
Right. And it's actually the surgeon's responsibility to refuse surgery to someone who has unrealistic expectations and motivations. That is part of our responsibility.
Can't the board kick him out for doing it?
It depends on if he's even board certified. A lot of people that are cosmetic surgeons in Manhattan aren't actually even plastic surgeons. I think 480 people call themselves that, but about 180 are board certified.
Okay. This is my thing. Every time I see a picture of Angelina Jolie, I go, oh, I would love to look like Angelina Jolie. I think she's really pretty. Do you have people that come in with photos of celebrities who look nothing like them and say, make me look like her?
Absolutely. That happens probably once every couple of weeks.
And what do you say?
Angelina Jolie is a big one. She actually, people come in and want her lips, people want her nose, and they may be...
I just want to be exactly like that. I want the body, I want the whole thing.
The thing that's a red flag, though, is when a woman who's 65 years old with blonde hair and who's 250 pounds brings that picture in, and that actually happens.
You're not referring to anybody on the set, are you?
Not at all.
And so how do you tell people, look, plastic surgery can do so much. What's realistic to expect?
Well, I let them know that I like to talk to them in 2 different consultations. I get an idea of what their motivations are. Are they having problems on the inside, or is this really a specific complaint about a certain aspect of their body? And from that, I can kind of glean the information that I know that we're on the same page before surgery. And absolutely, I would refuse surgery to anyone that had any sign of the things we're talking about.
Okay, so be realistic. Go and talk to a number of people before you pick one person. Don't just go to the first person. Right. And you can't look like Angelina Jolie, probably. Thank you very much.
Not many people can.
Dr. Jennifer Walden.
Thank you.